ALDA, the free automated LGMD diagnostic assistant, was designed to help physicians diagnose patients that are thought to have some type of LGMD. It includes all the genetically defined LGMDs, as well as a number of muscular dystrophies with overlapping clinical phenotypes that could be mistaken for one of the LGMD subtypes. Using the diagnosis tool is easy. To begin, just enter a patient identifier, something that will help you identify the patient later. Next, answer a few questions regarding the patient's family history. For example, if the patient has family members with similar symptoms, you add relatives by clicking here. You can always delete individuals by clicking on the trash can if you need to revise your answers. If the patient has already had genetic testing that ruled out any of the diseases listed, you can select it to exclude it from the results. We recommend running the tool initially without excluding any diseases to see the unbiased results. Please note that diseases should only be excluded if there is genetic confirmation and should not be excluded based solely on protein data. To go to the next page of questions, click the Next button. As you answer each question on the next 2 pages, the graph to the right will automatically update to show the current predictions. If you hover your mouse over a question, you will see a more detailed description of that question. Similarly, when you hover your mouse over the names of each disease on the graph, it shows you the associated gene and protein name. You can learn more about the individual diseases by clicking on the disease name. If you forget to answer any question, an error message will appear and the unanswered question will be highlighted. The third page consists of secondary questions that will vary depending on your answers on the second page. You can go back to the previous screens at any time to change your answers by clicking on the back button. You can also reset all the answers on each page by hitting refresh. After you have answered all the questions, a report will be generated that shows the predicted probabilities for the most likely MD, as well as the associated concordance scores, which assess how closely the patient's presentation corresponds to the typical phenotype for that particular disease. You can download or email a PDF version of the report by clicking on the PDF button. If you like the tool and would like to share the link with others, just click on the Refer Link button. To start a new patient, click the Start New Patient button. To send us feedback about how the tool performed and whether you were able to confirm the diagnosis, or if you have any questions or issues with the tool, please send us a message by clicking here or contact the Jane Foundation by using the contact information provided here. We are currently running a free genetic sequencing program. If your patient is eligible for free genetic sequencing, a pop-up will appear on the report screen. If you want to submit your patient for free genetic sequencing, hit Yes and follow the directions. Fill out your contact information and be sure that your fax and NPI number are correct so that the copy of your patient's report can be sent to you. After submitting your patient for the free genetic program, an email will be sent to you explaining the next steps and providing you with a reference number for your patient. You can also print the instructions directly from the website for later use. If you need to contact us about this patient later, please use the assigned reference number mentioned in the instructions. In order for your patient to participate in the free sequencing program, you need to send the instructions included here directly to the patient, and the patient will need to follow this link, which includes the reference number, and provide an address where the DNA collection kit can be sent.